So it's 12:03. Let's kick off. It is my great pleasure to welcome everybody here today for the first Lunch and Learn talk of the 21-22 academic year. And no one better to kick off the series than Dr. Sarah Hunter. Sarah and I have had the pleasure of working with Sarah on a couple of projects, but this was the one she'll be presenting about today is the first big one. Before we dive in, I'd like to start with our land acknowledgements. And while we are all sitting remotely or predominantly remotely at this time, I do want to acknowledge that Georgian College and our facility is located on the traditional lands of the Anishinaabe people. The Anishinaabe include the Odawa, Ojibwe, and the Potawatomi nations, collectively known as the Three Fires Confederacy. We are dedicated to honoring Indigenous history and culture and committed to moving forward in the spirit of reconciliation and respect with all First Nations, Métis, and Inuit people. And while you may not be on the land, the traditional lands of the Anishinaabe people, I encourage you to also go out and understand which lands you are, so which traditional lands you are situated on, to have a better understanding of our history and our present. And so with that, it's my pleasure to welcome Dr. Sarah Hunter and Nicole Adams. Sarah Hunter is with Georgian College, currently on secondment, but still teaching, I believe, and recently completed her doctorate. Nicole Adams is with Waypoint Centre for Mental Health Care, and I have learned she is now the research coordinator in the Research Institute at Waypoint. So welcome, Nicole and Sarah. Over to you, Sarah.
Thank you very much, Mira. It's nice to be here, and thank you to each of you for your presence and your time today. So we're going to begin with a little bit of context, and then we'll journey through the beginning, middle, and end of our most recent research study. So for those of you that I haven't had the chance or opportunity to connect with or to meet, my name is Sarah Hunter, and I work in student services here at Georgian College. More recently, I've had the opportunity to work as a faculty research lead here at the college, which has allowed me to dig in and explore the well-being initiatives that have piqued my interest within student affairs. I'm currently on leave from my position in student services, working as the head of research and innovation for a global mindfulness nonprofit. So this time last year, I completed my PhD in educational sustainability, where I examined the role of the first year experience course on post-secondary student success. And although that's been really excited and an exciting thing to talk about, what I chose to talk about today is something that really intersects this work, which is resiliency. It was woven throughout my findings with post-secondary students, and something that I've had the opportunity now to dig in a little bit deeper. So today I'm choosing to share the findings of this recent NSERC funded study, funded by a rapid accelerated funding through COVID-19. And it reveals the effects of a brief mindfulness program on mitigating burnout, something that resonates with many who feel they are personally on the path towards burnout, or for those of us that are looking to safeguard the people that we seek to serve, whether that be students, staff, or faculty, from burnout through building or awakening resiliency, perhaps. Our study investigated the impact of a 4-week brief mindfulness program on mitigating burnout in healthcare workers amid the COVID-19 pandemic. So the study that we'll be sharing today has been designed and conducted collaboratively by a team composed of myself and folks from Waypoint Centre for Mental Health Care. Dr. Soyeon Kim was at the helm of this study and is a research scientist at Waypoint. Nicole Mace, an organizational planning and development and human resources at Waypoint, and Nicole Adams, who's here today. Nicole, you can go ahead and introduce yourself.
Thank you, Sarah. Hi, everyone. I'm actually really happy to be here and presenting alongside Dr. Sarah Hunter. As Mira so kindly shared, I am a new research coordinator at Waypoint. Previously, I was a research analyst, and I have a bachelor's in psychology and a master's of science in kinesiology and health sciences. Much of my research and interest focuses on mental and emotional well-being, and I was more than happy to assist and support in spearheading the mindfulness projects alongside an incredible and dedicated team at Waypoint, which includes Dr. Soyeon Kim and Nicole Mace, who aren't here today. But there are many projects currently in the works as the team strives to enact awareness and change in health and wellness policies. And I'm happy to be here and present alongside Dr. Sarah Hunter. And I will pass it back to her.
Thank you. And so, although we are not joined by our full team today, it is important to recognize their contributions, including those that aren't present. They were essential drivers in the work that we're sharing today. So we thought we would begin today's session with a brief practice. The research study that we have enacted investigated the efficacy of brief mindfulness practices, not longer, lengthier, robust practices, but rather brief, short 3 to 5 minute practices. So we're going to start with a 3 to 5 minute practice. I will facilitate the practice, and we're going to encourage you to join in if you are comfortable. And we're going to begin by inviting you to turn off your cameras. And I'll do the same just to provide you the space and focus needed. And then if you have any browser tabs that might be open or anything besides this Zoom meeting that you can close or perhaps turn away from yourself so that you can engage fully. And then invite yourself, when ready, into a comfortable position. Allow the soles of your feet to connect to the floor. And if possible, rest your hands on your thighs and allow your shoulders to drop. Gently close your eyes or look for a reference point somewhere on the floor. Somewhere that you can return your focus to if you become distracted. As you settle here, invite your spine to grow tall and noble, like the trunk of a tall tree. Take a moment to notice how your body feels, perhaps for the first time today. Now begin to bring your attention to the flow of your breath. You don't need to breathe in any special way. Your body knows how to breathe. Simply notice each breath coming into your body with an in-breath and leaving your body with an out-breath. If you notice that your mind is caught up in thoughts, emotions, or body sensations, know and trust that this is normal. The act of noticing these distractions is the practice of mindfulness. Notice what's distracting you and gently let it go. Redirecting your attention back to the breath. The idea is not to judge your experience, rather to be kind and compassionate to how you're feeling in the moment. Allow each in-breath to be a new beginning, and each out-breath to be a gentle letting go. When you're ready, slowly begin to shift your focus from your breath back to your surroundings. If the eyes are closed, gently awakening them. And just noticing where you are. Taking a moment to awaken external awareness. Noticing what's in your space, maybe looking beside you, behind you, around you. And then bringing yourself back to this online environment, back to your computer. And then returning into this space when you're ready. So an important part of secular mindfulness is building the muscle of awareness. It's about learning to pay attention with attention. And perhaps you noticed yourself becoming distracted as we spent a moment in brief practice today. And what I would encourage you to notice within your experience is that noticing when you're distracted is in fact that building of the muscle of awareness. Noticing what's distracting you is mindfulness. The program that we will share today that we have researched the efficacy of is a brief mindfulness program grounded in secular mindfulness. Mindfulness that does simply that. It acknowledges awareness, paying attention on purpose, non-judgmentally in the moment. So to build on this awareness, we're going to provide a moment here for connection and for a collective check-in. And we're going to invite you to grab a pen and a piece of paper and to take just a moment here to partake in an activity. So if your mood or your feeling in this very moment, without judgment, was a line, what would it look like? And there's a few little rules here for this check-in that I'll share with you. So don't take your pen off the paper. You're going to draw a continuous line. Your line doesn't need to be linear. It can transform into any shape, abstract or literal. Trust in the process. And then of course, participating or sharing later is always optional. So we're going to give you just a moment to put pen to paper and draw your mood or feeling in this moment as a line. All right. And then if we have a few brave or adventurous souls that have veered down the path of drawing your mood in a line, feel free to turn your camera on and share if you're comfortable. What does your mood in a line look like? No judgment. Oh, I see some lines here. Thank you, Nicole. I'll scroll through the chat, see if I see a few. Awesome. And a few personal notes. Yes, thank you. That's awesome. All right, so as we move into sharing a little bit about our mindfulness program, you really now have experienced the first two tenets within the mindfulness program, which is the brief practice and the emotional awareness of checking in and naming how you feel in the moment and proceeding with that awareness. So today we're going to take you on a journey of our project from beginning to end. We'll start at the beginning with the design of the mindfulness program, and then we'll share our study design and findings, and then conclude by sharing where the project has evolved to and the next steps and the future research that's being conducted in this area. So under the leadership of Nicole Mace at Waypoint Centre for Mental Health Care, the institution had established a comprehensive mindfulness program prior to COVID-19. This involved staff and leaders. It was facilitated by employees for employees and by leaders for leaders. And many of Waypoint's employees also extended this work into their mental health and patient programming. Although the journey of this project starts at the onset of the COVID-19 pandemic, Waypoint's adoption of and integration of mindfulness into their work begins a few years prior. At the onset of the pandemic, Nicole Mace at Waypoint built on the momentum of the mindfulness ecosystem that existed as part of their psychological safety initiative within the hospital. So Nicole considered the added demands placed upon healthcare workers, the availability and constraints on their time, and balanced this with the knowledge that the pandemic would greatly change the stress exposure of healthcare workers. So Nicole set out to retool their existing mindfulness program and use it to better meet the needs of healthcare workers when the pandemic began. So a little bit more about the mindfulness program. So prior to the pandemic, Waypoint had been using the 12-week Mindfulness Ambassador program that's been developed by Mindfulness Without Borders. This is an evidence-based program that's used globally. The program is built on the tenets of social and emotional intelligence and secular mindfulness and the practice of counsel. So this program traditionally delivered face-to-face at Waypoint over 12 one-hour sessions, and it was retooled into 4 30-minute sessions, the goal of which were to wrap participants in compassion and care through an experiential learning program. Nicole led her team of certified mindfulness ambassador facilitators through the process of facilitating the brief adapted program virtually to meet healthcare workers where they were at home, in their cars on lunch break, or tucked away in an office between patients. Nicole partnered with the Provincial Frontline Healthcare Worker Wellbeing Initiative to extend the reach across the province. The program retooling was supported by Mindfulness Without Borders, and it was facilitated still by certified facilitators from Waypoint. It was offered free of charge and for anyone interested in attending. Multiple sessions were offered at varied times to meet varied schedules. In a nutshell, Waypoint Centre for Mental Health Care recognized that the 12-week or 12-session 1 hour a session in-person program wasn't going to work in the online pandemic environment, yet also recognized that this is when healthcare workers needed resiliency strategies most. So now let's take a bit of a closer look at what composed the BRIEF program. So the BRIEF program aimed to maintain the integrity of the social and emotional pillar and the secular mindfulness pillar. It took the 12-hour robust program and brought it down to 2 hours. 4 30-minute sessions. So the program included a check-in to cultivate self-awareness, guided brief secular practices, self-reflection prompts, and takeaway self-care strategies, as well as follow-up resources. The program taught skills such as mindful listening, mindful movement, body scan, anchor breath, all of which participants had access to recordings to support continued practice. The program was facilitated again by healthcare workers for healthcare workers. And we adopted the World Health Organization's definition of who a healthcare worker is. So this included all folks supporting and moving healthcare initiatives forward. That could include administrators, support personnel within a healthcare environment. The program was open to folks outside of healthcare, though only by word of mouth. And we only invited folks from the program who identified as healthcare workers to be part of our study. So we specifically looked at the program's effects on healthcare workers. So the 4-week program offered the perfect opportunity for research to be conducted. At the onset of the pandemic, there was very little research evidence that existed on the efficacy of online mindfulness programs. Most research historically had looked at in-person delivery of mindfulness programming. Further, there was very little evidence on brief programs. Most of the research on mindfulness has been conducted on more robust programs, such as the Mindfulness-Based Stress Reduction Program, which is delivered over multiple sessions and multiple days. So what we wanted to look at here is, could the small, short, condensed program still move the needle on well-being? And within this study, we really wanted to look at the dose relationship. How much secular mindfulness education is needed to have a positive effect on well-being? So first, we sought to explore the efficacy of a brief program on burnout, empathy, and resiliency. And we looked here at the effect of empathy and resiliency on mitigating burnout. And we sought to explore if the findings were sustained 4 weeks following the program. In a perfect world, if this was a longer research study, we would have maintained those effects and looked at those effects over a lengthier period of time as well. And now I'm going to turn it over to Nicole, who will share more about the study design and what we found.
Thank you, Sarah. So as Sarah was kind of like touching on, this 4-week mindfulness program was a unique contribution to the mindfulness educational community and provided an opportunity to explore the efficacy of a brief intervention and contribute to what is known about the dose relationship between mindfulness and well-being. So what I'm now going to do is walk everyone through the methodology and the results of the project. So participants were offered through Waypoint's Frontline Wellness Program to participate in a brief 4-week mindfulness program. So when participants signed up, the research team would then email them, asking them if they would like to participate in the research project by filling out some surveys with questions pertaining to their demographic information, their resiliency, empathy, and burnout. So when participants consented to partake in the study, they were then asked to fill out 3 surveys at 3 different time points. So the first one was administered right before they started the program. The second one was administered right after they completed the program. And the third and final survey was given to them 4 weeks after they completed the program. So in order for us to by doing this, it allowed us to measure for any significant differences between the 3 time points. So the pre, post, and follow-up. And it's important to note with the follow-up survey, this was important because it allowed us to measure or observe for any sustained effects. So on the next following slides, I'm going to now share the scales that we used in the study. So obviously we had demographic questionnaires. These questions were included in the pre-survey only. So we assessed things such as their age, their gender, whether or not they had previous participation in mindfulness programs, and years working as a qualified healthcare professional or just in the healthcare field. The Nicholson-McBride Resiliency Questionnaire is a 12-item abbreviated version of the NMRQ, and it assesses the capacity to bounce back from extreme occasions or even to triumph in the face of hardship. The Interpersonal Reactivity Index is a 28-item scale designed to assess 4 components of empathy. So the first one being empathetic concern, which is described as a feeling emotional concern for others. The second is perspective taking, which is cognitively taking the perspective of another. 3 is the fantasy scale, which is the emotional identification with characters in books and or films. And 4th is personal distress, which is the negative feelings in response to the distress of others. We also use the Maslach Burnout Inventory, the MBI, which is a 22-item scale designed to measure 3 aspects of burnout. So the first one is emotional exhaustion, which is feelings of being emotionally overextended and exhausted by one's own work. Second is depersonalization, an impersonal response toward recipients of one's service, care, treatment, and or instructions. And the final one is personal accomplishment, which is feelings of competence and successful achievement in one's work. So in the next several slides, I'm now going to walk you guys through the demographic data. So this study was composed of 131 healthcare workers across the North Simcoe Muskoka area, 93% of whom were female. Age was distributed and 53.5% were between the ages of 31 to 50 years of age, and 50% of participants reported that they have been working in healthcare for up to 10 years. So we wanted to better understand if and how many of the participants had any previous mindfulness experience, and 64% reported having no previous mindfulness experience before taking the program. We also asked participants about the type of support that they provided in their job. So whether it was directly working with patients, so providing face-to-face support, or virtual care, or non-clinical support. And this included anything from working in IT to research to administrative. And we grouped the responses into either direct care or indirect care. And we found that 53% reported working in direct care. So they worked directly with patients. We also wanted to know and identify how many sessions each participant attended out of the 4 sessions. As Sarah so kindly shared that when she was talking about the program, it was a brief mindfulness program. So there was only 4 sessions that they were being asked to attend, and 55% of participants attended all 4 sessions. In the program, participants were asked to voluntarily practice mindfulness on their own time. It was kind of like a takeaway exercise. So as such, we asked participants how often they practice mindfulness on their own time in the post and the follow-up surveys. And what we found is, like, when you look at the diagram here, the green on the left is the post and the blue on the right is the follow-up. And the majority of participants indicated that on average, they practice mindfulness 1 to 3 times per week on their own. So it was 65% in the post and 69% in the follow-up. So to detect for any significant differences, we ended up using a repeated measures ANOVA. So for burnout, the emotional exhaustion scores differed significantly across the 3 time points. So a post hoc pairwise comparison found that there were significant decrease between the pre and the post survey, and between the pre and the follow-up survey, suggesting that this brief modified MAP intervention decreases emotional exhaustion and that these effects were sustained. The mean personal accomplishment scores, which is another subscale of burnout, differed significantly as well between the 3 time points. And a post hoc pairwise comparison showed a significant increase in the personal accomplishment mean score between the pre-survey and the post-survey, suggesting that the modified MAP intervention increases personal accomplishment. For resiliency, significant differences were detected between the pre, post, and follow-up scores. So a comparison found that there was a significant increase between the pre and post scores, as well as a significant increase between the pre and follow-up scores, which you can see on the line graph here. This suggests that the online mindfulness program is not only capable of developing and equipping participants with the skills to become more resilient, but that the effects persist and continue over time, even 4 weeks after they've completed the mindfulness program. For empathy, we didn't observe any significant differences on the perspective taking, the empathetic concern, and the fantasy subscales. However, we did find a significant difference on the personal distress subscale between the pre and the follow-up scores. So when you look at the line graph, you will notice that the personal distress scores decreased over the duration of the mindfulness program and continued to decrease 4 weeks after the program completed, suggesting that the program can leave lingering protective benefits to help participants alleviate and manage feelings of personal distress. And this could also tie into the increase of resiliency that participants gained at the conclusion of the mindfulness program. So just to kind of summarize for you guys briefly what we found a decrease between the pre and the post and the pre and the follow-up on emotional exhaustion, suggesting that the brief 4-week online program, there was a intervention decreases emotional exhaustion and that these effects were sustained. There was also an observed increase between the pre and post, suggesting that the MAP intervention increases personal accomplishment. For resiliency, there was also an increase between pre and post and pre and follow-up, suggesting that the brief 4-week online MAP intervention strengthens resiliency and that these effects were sustained. I think it's important to highlight that the study suggests that even a brief mindfulness program can strengthen resiliency in healthcare workers. Resilient people, I want to say resiliency is a really important tool in burnout, and that resilient people are more likely to seek out support and have the ability to view or change stress as a challenge. And and also same thing with personal distress, that we noticed that there was a decrease observed as well, and that this brief program also had a significant impact in decreasing personal distress amongst frontline healthcare workers. So that's it for me. I'm now going to pass it back to Sarah.
Thank you very much, Nicole. So as our study has shown and what's been discussed here today, even a brief amount of mindfulness education can move the needle on well-being. So previous research conducted prior to this study is clear that the skills to combat feelings of stress and burnout are important to develop early in someone's career. When people are experiencing symptoms of burnout, such as at the onset of the COVID-19 pandemic till now, it might be difficult to muster up the energy to enroll in and participate in wellness programs, such as mindfulness, to help strengthen, develop, and teach these skills to help manage things such as stress and anxiety. So this, coupled with what we've learned about the impact of a brief program, emphasizes the importance of our role in higher education. As educators and supporters of student well-being, this really hits home. Our work on embedding the skills required for resiliency is really important work. As we know, and as COVID has affirmed, stressors can't often be eliminated, but rather the human's response to stress and the ability to move through stress can be influenced. So programs such as mindfulness education have the capacity to influence how someone processes and works through the stress cycle. Rather than staying stuck in stress, this capacity to move through stress can be built and developed through cultivating self-awareness, self-management, and social and emotional intelligence, and through learning how to pay attention, how to awaken present moment awareness, and how to activate the parasympathetic nervous system, the rest and digest. Emotional awareness and the skills contained within the programs such as breathing, body awareness, and present moment awareness support movement through the stress cycle and support well-being, and they should be taught as foundational skills within well-being and self-care education. So even with the continuous ongoing stressor that COVID-19 presents, the online Mindfulness Ambassador program helped to teach and develop the skills that support the alleviation of burnout symptoms. So the results of this study also support the efficacy of a shorter online program. When administrators and program planners wonder, does a small amount even help? Our study affirms that yes, even a short program can support well-being. Facilitators of programs should also rumble with these findings to better convey this to participants, helping them to buy in and commit to brief continued practice, knowing that consistency over time may matter more than the amount of time spent. The efficacy of an online program has far-reaching implications on connecting with harder to reach populations, such as healthcare workers with varied schedules now and demands, and other populations in remote regions, including those who don't have the time to commit to more intensive programs. The program was delivered in real time, and future research really should explore the effect of an asynchronous program to further increase access in underserved communities without access to reliable internet. It would always be interesting to investigate the potential effects of a program like this on healthcare students here at Georgian College or in post-secondary, and to new professionals to measure their experiences in relation perhaps to intentions to quit, professional retention, or burnout, factors that are of greater importance now during the pandemic. Future studies should also investigate who sees themselves in mindfulness programs, to look at how to best serve underrepresented groups, or to expand the reach of who mindfulness is for. I've had the joy of connecting recently with some researchers at Ryerson University who are examining mindfulness from an equity perspective to add this to the literature and expose how power is experienced and reinforced within Western approaches to mindfulness. So their findings should inform a more critical approach in future studies as well. Lastly, longitudinal studies, studies that measure people over time. So following our healthcare students, perhaps from education into career or career over time, should be explored to see if the long-term maintenance effects, including if or how they practice, are maintained over time. In terms of our next steps, we thought it would be nice to share with you today some of the next steps within this project. So since starting this project, the team under the leadership of Dr. Soyeon Kim at Waypoint Centre for Mental Health Care has secured a SSHRC grant, a Social Science Humanity Research Council Partnership Engagement Grant, to better qualitatively understand the experiences and participants in this program and the facilitators, to bring voice to their experience and support program improvement and facilitator training. And the qualitative component in that study complements the findings found within this study to really start to paint a broader picture.
Another study that I'm going to share with everybody today is it's funded by SSHRC IDG, and Waypoint Centre for Mental Health Care is currently running a study to understand the impact of the 12-week Mindfulness Ambassador program that Sarah introduced at the beginning of the study, which is being delivered, sorry, excuse me for the background noise, which is being delivered online to youth. And we're trying to understand its impact on increasing social emotional competence in youth between the ages of 12 to 25. This project has multiple partners throughout Ontario. And as I mentioned before, it's currently being funded by SSHRC IDG. I believe Sarah's going to put into the chat box for everybody, but if anybody ever wants, has any interest or would like to learn more information about the current projects that are being conducted at Waypoint, you're welcome to reach out to mindfulness research at waypointcentre.ca, and you can connect with either Dr. Soyeon Kim, Dr. Kimberly Belfry, or myself, Nicole Adams, if you guys have any questions or would like to know more information about the projects that are currently being organized and run at Waypoint.
And thank you, Nicole. I just put the mindfulness research email address in the chat. And as I share gratitude for everyone's attendance today, and we begin to consider future research in this area, I would also like to share that as this project sunsets, a new project begins. So together with Tracy Mitchell-Ashley and Susie Addison-Tour, we have secured a next research project we'll be working on, which is funded by the Community College Social Innovation Fund, administered through NSERC. And there we're going to look at how to support changemakers and change-making efforts within our region using community-based research and participatory action research. And although the two research projects perhaps can feel or look disconnected, they share much in common. A shared purpose on how to inform how we best support and fuel well-being and social transformation here in our area. As we wrap up today, we'd also like to share gratitude for the folks that funded the study that we share today, which is Georgian and NSERC and Mindfulness Without Borders for their support on the study. And then the collaborative partners who are supporting the research efforts on mindfulness at Waypoint Centre for Mental Health Care, who are the other folks mentioned. And we do have some time, I believe, now for some questions, if there are any. And maybe you can just unmute if you have questions, or you can drop them in the chat, and we're happy to chat through them.
Thank you so much, Sarah. Nicole, I have a question to start off, and it builds on the comment that I had in that chat box when you talked about the demographics. I think it's a 93% female. And it's interesting because, you know, having healthcare providers in my own household, trying to convince him, i.e. my husband, that mindfulness is a tool in his toolkit, not the only tool, but he should explore. What are your thoughts on how you overcome some of those barriers for folks who are pushed to a limit, who are over capacity in work and potentially don't buy in right from the beginning?
Yeah, I think that's a great question, and definitely something that the team has spent some time considering and thinking, and I know is a priority at Waypoint to consider how to engage underserved or folks who aren't attending some of these initiatives. I know within Waypoint, the uptake on the mindfulness initiatives has been really strong and represented through, I believe, both genders and different subsections of the population. So they have clinicians who attend, they have psychiatrists who attend, and they have folks working in admin. And that top-down, bottom-up approach and meeting in the middle with both administrators and staff facilitating the program, I think has increased that buy-in. But in terms of the 4-week program, the folks that participated in the study, mainly women, were also representative of who was attending the program, according to facilitators. And I do think that perhaps self-care is really sold with appeal to women in a way that it's not to some men. I also think that within who sees themselves in mindfulness, there can be this reluctance or a lack of understanding of what mindfulness is, and the idea that mindfulness being synonymous with meditation or like sitting crossed legs with candles lit and a yoga mat is mindfulness. And the 4-week program really worked to debunk that myth and to really show mindfulness as intention, as moments of pause, of awareness, whether it be a cup of coffee and smelling the coffee and really noticing the coffee and enjoying your first few sips versus mindlessly getting to the bottom of the cup of coffee without having tasted it. So these examples of really trying to help folks understand the integration of mindfulness into daily life, I think is going to be one of the factors that does overcome the stereotype of who mindfulness is for and what meditation looks like. I also think that's something that at Georgian we've been very conscious of with mindfulness efforts, is to really approach mindfulness from a secular place of building the muscle of paying attention. And I mean, the applicability to learning. If we talk to faculty, one of the concerns that I hear most often shared is students paying attention or not, engagement being a factor of attention. And really the practice of mindfulness seeks to build the human's capacity to be able to pay attention with attention. And maybe it's just selling it that way to folks who would see the value in that approach versus the value of, lying down and meditating or taking time to relax. Oh, you're muted, Mira.
Of course. Yeah. And just, it's interesting that while it is an online program in this era, by force, not by desire, but it still had an impact on the community, which is really interesting to see.
Yeah, and the program continues to this day. So I believe the last check-in I had with Nicole Mace, there's been over 1,000 people through the frontline healthcare worker mindfulness program. A small portion of that group participated in our study at the time of which we surveyed, but the program continues to gain momentum. It has registrants. People are attending the program multiple times for continued supported practice. And one of the other grants that Nicole and I've had the opportunity to work on, I was able to interview a lot of folks who had attended the program and facilitated the program as a qualitative component. And although not part of this study, a lot of folks shared just like it bubbled up to the top of those interviews that the opportunity to attend at work or to attend outside of work was really supportive to people. So a lot of healthcare workers said, like, logging on and doing this at 7 o'clock at night really helped me switch out of work mode and into life mode. And so maybe we start to look too at the ways in which we support people outside of that traditional, work time, lunchtime activity, and start to think about how this program can better meet people's needs at the off time and the time where a program's not offered. And maybe that's how we appeal to somebody like your spouse.
Thank you. Any other questions out there from the group? So Jamie has a question in the chat. I might have missed this, but how does the mindfulness program differ from those who are already knowledgeable about meditation, etc.?
Yeah, that's a great question, Jamie. And I think that would resonate with me. I have been practicing meditation and teaching mindfulness for a long time. And when I was introduced to the Mindfulness Ambassador program, it was quite different because it was secular and it was based in these brief practices. And mindfulness practices aren't known for being brief. They're known for quite the opposite. So a lot of meditation practices are 20, 30, 45 minutes in length for a practice. So I think one of the big adjustments for folks that entered this practice with previous mindfulness experience is really learning about that integration piece, the small brief moment of cultivating awareness. What a lot of participants shared is, the act of grounding, the arriving practice that we did together isn't so robust that it can't be done when you're in line. And you need to create a buffer between an experience and a reaction. So instead of experience reaction, it's experience, pause, and then proceeding with thought and intention. So for a lot of people, it's seeing that relatability for being able to enact those practices in daily life what we would say like off the meditation mat or, outside of the chair. So really practicing in life. And for some people, they will do both. So they'll adopt the brief practices within the program and maintain their longer, lengthier meditation practice, and find a way for the two to complement. Or they'll reject the brief practices, enjoy the other components of the program, and then they'll continue on with their lengthier practices that are supportive for their own well-being. Are there any programs running currently at Georgian for employees and students? And echoing Kat's question, yes, there are. So Jennifer, who works in organizational planning and development at Georgian College, is a certified mindfulness ambassador program facilitator and is facilitating the Mindful at Work program, which is another program that was developed from Mindfulness Without Borders. It's an 8-week program. So I do know Jennifer's been posting about that in staff news, and we've connected on that a few times and are connecting again next week. I know this is something that's really important to human resources, that they're getting the questions, is their mindfulness programming, and they are working hard to roll some of that out. Within student services, there's also a lot of mindfulness programming for students. So the mental health team, Jennifer Lloyd and Kate Henry, they also champion the Mindfulness Ambassador program within the school. And I think there's a team of about 20 certified facilitators at the college who do this work on and off with students. Although the movement to the online environment has been, I think, quite a challenge for online programming, but I'm hopeful that Nicole's other study that she shared, the IDG study that's looking at this program being used with youth online, will maybe start to give us some ideas to how we can better do this work in a way that gets students to attend and to be in the space of community as well for a well-being initiative.
I have a question for Nicole. Have there been thoughts through Waypoint, or is there any offerings for a greater population than the healthcare workers, for the patient population in particular at Waypoint?
Yeah, I feel like that's a really great question. And I think like when it comes to the patient population, there's still a lot of, I want to say, things that need to be worked out in order for us to be able to include it into the population. I do know that we do offer mindfulness programs, like Sarah was mentioning before, to our frontline workers. We are currently running a study offering it to youth in the community to try and see if maybe we can help build their social emotional competency. So I mean, like, there's a lot of stuff that we're slowly working. I mean, like, it's definitely it's been in conversations about implementing it into the the patient population and what would that look like, but it's still very much in very beginning conversations and stuff. So I mean, like, definitely stay tuned, but it is something that is on the radar.
And I think there's a few, Nicole, there's a few folks using it at Waypoint that maybe it wasn't a top-down initiative in the department, but people who've been certified to facilitate with staff who have since turned around and used it. I talked to one addictions counselor who wasn't certified to use it with their clients, but has since been using it with their clients. And I think that's where that approach becomes a bit grassroots, and we saw this at Georgian, folks who were comfortable with mindfulness, who had a skill set already, would do this work in every space they were. And then people who were curious about this, that's where reaching out and building capacity through a certification program, which is how we partnered with Mindfulness Without Borders, would build the capacity where there was interest. And then those people, for example, Jennifer, that's doing this work in organizational planning, was doing this work in her EAP class as well, with great success, and fully embedded the program alongside the curriculum. But it really becomes dependent on the faculty, the teacher, the staff, the admin, the person who has that skill and ability to do the work. And that's a unique driver of this and a limiter of this work as well. Yeah.
Wonderful. Any other questions out there? I don't see anything in the chat. Any other questions from the folks listening? If not, I'd like to thank Sarah and Nicole so much for this presentation and for this research. It is always enlightening. And, I think for me today, it clicked, that difference between mindfulness and meditation. And you articulated it really nicely, Sarah. the difference in that I am not committing necessarily to 20 minutes lying on my back or sitting with my eyes closed, but it's a brief moment. And I understand why my watch keeps telling me to breathe, to bring intention to these moments throughout the day in a very brief, manageable way. So thank you for that. Looking forward to seeing folks back for the next Lunch and Learn. Our next Lunch and Learn is next month, where Dr. Isabelle Deschamps, October 12th, will be talking about continuing along the theme of mindfulness and well-being. Dr. Isabelle Deschamps will talk about her research about stress, coping strategies, anxiety, and depression among first-year college students, and gaining insights into Georgian College's student population. So it's actually a really nice connection, talk that complements what we've heard today.
Yeah, I will put that one on my calendar.
Yes, definitely. Sounds really interesting.
Fantastic.
Awesome. Well, thank you very much for the opportunity. And Nicole, thank you so much for being here also. We appreciate all of the time, attention, and care that Waypoint has supported with this project. So it's great to finish it off in this manner.
Yes, for sure. My pleasure. And thank you everybody for having us here. It was honestly amazing to be part of this talk. So appreciate it.
Wonderful. Thank you so much. Have a great day, everyone. Bye.
Thanks. Bye, everyone.